Administration of life-saving medications in the pre-hospital setting may be one of the most important things an EMT will do for their patient. It requires the ability to recognize life-threatening conditions, such as hypoglycemia or an asthma attack, knowledge of which medications are used to treat these conditions, and how those medications are administered. Some medications can be administered by the EMT, such as aspirin for chest pain and oral glucose for hypoglycemia, while other medications, such as nitroglycerin for chest pain, bronchodilators for difficulty breathing, and epinephrine for allergic reactions, must already be prescribed to the patient, and the EMT will only be assisting the patient with his or her own medications. Injectable medications are not commonly used at the EMT level. However, an epinephrine autoinjector, a truly life-saving drug, is one exception. This medication is physician prescribed and will be carried by patients who have known severe allergies to substances such as peanuts or shellfish, or insects such as bees. An epinephrine autoinjector is a disposable, prepackaged delivery system that allows the patient to self-administer a single dose of medication into the thigh muscle. Since the patient may be experiencing extreme respiratory distress, hypotension, or an altered mental status, they may need your assistance in administering the medication via autoinjector. The recommended location for delivery is usually on the outside of the thigh, midway between the hip and knee. When the autoinjector is placed on the thigh and pushed firmly, a spring-loaded mechanism drives a needle into the thigh and automatically injects the medication. Signs of anaphylaxis or severe allergic reaction may include altered level of consciousness, rash, hives, swelling of the hands, face, or tongue, shortness of breath, pale, cool, moist skin, tachycardia, and/or hypotension. If the patient has been exposed to a known allergen, then do not wait for all of the above signs and symptoms to develop before assisting with their epinephrine autoinjector. Serious allergic reactions or anaphylaxis can be quickly fatal. Early administration of the autoinjector will be essential to the patient's survival. You will need the following equipment to assist a patient with their epinephrine autoinjector: BSI equipment, the patient's epinephrine autoinjector, blood pressure cuff, and stethoscope. Here are the steps to follow when assisting with the administration of an epinephrine autoinjector. Take BSI precautions, then examine the patient's prescribed autoinjector. Ensure that it is the right medication prescribed to the right patient and that it is not expired. The autoinjector delivers the right dose of 0.3 milligrams of epinephrine intramuscularly at the time of a severe allergic reaction. Explain the procedure to the patient, gaining his or her consent for assisting with the administration of the medication and ensuring that they are prepared for the sharp stick of the autoinjector needle. Remove the cap from the autoinjector. Expose the thigh area if it is fast and easy to do so. If not, at least ensure there are no keys or objects in the pants pocket that could prevent the needle from entering the thigh muscle. Place the autoinjector device on the lateral thigh midway between the knee and hip. Apply steady pressure on the autoinjector at a 90-degree angle to the thigh until you hear the device inject the needle. Hold the injector in place until the medication is injected or for at least 10 seconds. Remove the autoinjector. Set aside for later disposal in a biohazard waste container. Observe the patient for relief of symptoms caused by the allergens, such as improved skin signs, mental status, respiratory effort, and blood pressure. It is not uncommon for the patient to remain tachycardic, which can be a side effect of the epinephrine itself. Consider the need for a second dose if the patient's condition is not improving and if approved by medical direction. Many patients may only be carrying a single autoinjector. If this is the case, transport without delay or call for ALS intercept. Document the time the medication was given and the patient's response to the medication.